When it comes to using manual therapy, we need to consider the fact that physiotherapy isn't always the place to start when somebody has back pain, neck pain, arm, shoulder pain, or pain down the leg, as we've been discussing earlier with the sciatic type pain. So here are some of the things that physiotherapists and doctors call red flags and yellow flags, things that mean you probably don't start with physiotherapy. Physiotherapy might be included in the treatment, but other investigations might be needed too. So number one is weakness and numbness. So in the exercise that we were looking at earlier, particularly the difficulty pulling the toes up towards you could mean that there's another type of damage to the nerve, and that should be investigated before you just proceed with physiotherapy or chiropractic or osteopathic treatment. Any loss of control of the bladder or bowel. So that can mean either difficulty going or difficulty holding it in. If you've got an otherwise unexplained fever, then you probably won't start with physiotherapy for back pain at the time. You need to investigate and find out what the cause of a fever is. And then what's delicately known as saddle anesthesia is next on our little list, and that simply means numbness, tingling, and loss of sensation in what you would call the bicycle saddle area, down between the legs, in what's also known as the perineum, and that would mean get that investigated first if you've got back pain that you're trying to get rid of. Then, does the pain change with movement or change of position? That's another thing that's very, very key. And if there's no change when you're doing those things, then it's quite possible that physiotherapy is not the place to start. It's unusual for ordinary or so-called simple back pain to start under the age of 20 and over the age of 55. So if it's just started before 20 or over 55, then you need to just check that you're not dealing with something else. Unexplained weight loss, if there's any of that happening, then other investigations might be needed to eliminate problems, and in that case then we might be dealing with tumours particularly. So that has to be investigated. If there's any possible relationship between back pain or neck pain and a major injury, so that's usually big falls from bicycles or horses or car accidents, that kind of thing, then again it should be eliminated by x-rays or scans as to whether there's been some fractures happening. Night pain is another one. Does the pain waken you at night? If that's the case, then the likelihood is you should have some other tests first before starting with physiotherapy. It's unusual to get middle back pain between here and here that's simply treatable by physiotherapy. Most manual therapists would want to know that other things have been eliminated first. Have you got morning stiffness that lasts more than 30 minutes or so? That tends to be a sign of what I'm listing as my last point, which is rheumatoid type diseases, so rheumatoid arthritis, that sort of thing. If any of that's present, then manual therapy is going to be it's a caution and not a point that means you can't have it. So those things need to be looked out for. Oh, and I wrote them all out so I didn't forget when I was just reading off the top of my head. So here, I'm just going to put them up on the screen so you can read them out too.